30% of the Nigerian adult population are estimated to be hypertensive. That puts it at a whopping 36 million. Now, here are 10 steps to put hypertension in check. And they are easy to remember by the acronym MEALS. And I'll take it one by one. Number one is medications. You have to take your medications as prescribed by your doctor as and at when due. You don't skip your medications and you don't stop your medications even if your blood pressure is normal. Before stopping or making any changes, you must consult your doctor. Monitor your blood pressure using a machine which you can use to check all by yourself at home or in the hospital. When you check your blood pressure, it's important that you document it in written or digital format. This will help your doctor to track how your blood pressure has been over time. The next term is E. E for eating right. Eating right means that in 24 hours you eat what is considered to be healthy. A 24 hours healthy plate, which is a plate that contains all the meals you eat in 24 hours, should look like this. Half of that plate should consist of fruits and vegetables, and the remaining half should be split up equally between protein and carbohydrate, healthy ones, of course. The next E is exercise, and exercise involves taking brisk walk, lasting 30 minutes at least 5 times in a week. In my personal experience, I've noticed that stretching it up to 1 hour every day adds more value than you can think of. The next term is alcohol. Alcohol is an absolute no. Take away, limit alcohol to low amounts or completely stay off alcohol, which is a healthier option for you. The next term is to achieve lower weight. Lower weights are important because to a large extent, the more optimal your weight is, the less your risk. Even patients who are hypertensive tend to notice that their dose of medications they require sometimes has to be reduced when they have lost significant weight. Significant weight loss will be up to about 10% of your gross weight. The next L is low salt intake. Low salt intake is generally associated with better blood pressure control. In fact, in certain populations, it is suspected that a significant contributory factor to hypertension is a large consumption of salt. The next alphabet is S. S, you have to stop smoking. Smoking has been directly connected and linked to as a secondary cause of hypertension or an aggravating contributing factor to hypertension. So you must stop this. Apart from primary smoking, where it is you who inhales the smoke, there's another phenomenon called secondary smoking, where you find yourself sitting where people are smoking. In fact, that is equally dangerous. If you spend your time in clubs where people smoke or in environments where people smoke, you may be smoking as much as 10 sticks of cigarettes per hour, depending on the density. The second S is to stress. Stress control is significant and very important, and you can achieve this by taking time out stressful work, meditating as often as possible, and you can also even go for a massage. Stress management is critical and important in the control of blood pressure and should not be neglected. The next word is to ensure that you go for your regular checkups. If you are hypertensive and you've been prescribed medication, you should not just assume that anytime these medications are exhausted, you walk into any chemist, patent medicine dealer, or pharmacy to just do a refill. From time to time, you should check up with your doctors because your doctors would want to check for things like target organ damage, which may affect the heart, the brain, the kidneys, and some other parts of the body. All of these are critical and important in ensuring that you put hypertension in check. And to wrap it up, your target blood pressure, if you're undergoing treatment, is a blood pressure on most days, on most times, equal to or less than 130/80. Thank you for your rapt attention. See you on our next broadcast. Sign out. So.